How's it going, YouTube? Dr. Freeman here from Freeman Chiropractic Wellness, and today I'm going to talk about something that I see in the clinic a lot, and that's sciatica. Now, the word sciatica is thrown around a lot, sometimes appropriately, sometimes inappropriately, and that's because a lot of people have been taught that it's synonymous with low back pain. Now, this isn't completely off base because it does involve low back pain, but that's actually just one component of sciatica. It goes a little bit deeper. Now, before we jump too far into the weeds, I do want to take a second to say that wherever you are in the world, whatever you happen to celebrate or not celebrate, I hope you're having a wonderful season. And if you happen to be somewhere that's similar to where I live, I can think of one good reason why your low back might be hurting a little bit more than usual. Now, if that does happen to be you, we're going to have some great tips for you in this video. Now, the tricky thing about defining sciatica is that it actually has two acceptable definitions in the healthcare community. The first definition is pretty straightforward, and that's any symptoms arising from a lesion to the sciatic nerve. Sciatica, sciatic nerve, it makes sense just given the name. But oftentimes when we're diagnosing sciatica, we're not looking at an MRI, we're not looking at images, we're really just looking at a collection of symptoms, we're putting our hands on the patient, we're figuring out what's going on, and for that reason, it developed a second definition, and that is low back pain with related leg pain. Now, one possible cause of this second definition for sciatica is, of course, a lesion to the sciatic nerve itself. This would check both boxes, but there are other things that can cause similar symptoms. One possibility would be a disc injury. If you injure a disc that puts pressure on a nerve root, especially one of the nerve roots that feeds into the sciatic nerve, that would be L4 through S3, it can mimic the similar symptoms. But sometimes when this pain is diffuse in nature, especially if that leg pain is diffuse in nature rather than sharp and shooting, when there aren't any other nerve-like symptoms, and especially when the pain doesn't make it past the knee, the problem isn't actually neurological at all. We can get back pain with accompanying leg pain from simple muscle spasms or trigger points in the low back referring pain down into the leg. One muscle that's notorious for causing this kind of pain is the piriformis muscle, and that'll be our focus for today's video. Over the next couple of weeks, we're going to discuss several other causes for sciatica. So if this isn't the issue for you, or if these tips don't help you, make sure to stay tuned over the next couple of weeks because we'll address those other types and we'll talk about different things that you may do to address them. So piriformis syndrome is going to be the topic of today's video. Piriformis syndrome occurs when the piriformis muscle compresses the sciatic nerve. This can cause pain, numbness, and tingling in the low back, gluteal region, and sometimes down the leg. This occurs due to an interesting anatomy, actually a diversity in the anatomy from person to person when it comes to the piriformis muscle and the sciatic nerve. According to a study published by the National Institute of Health, the sciatic nerve actually passes directly through the piriformis muscle in about 10% of people. These are the people who are going to be at the highest risk of developing piriformis syndrome. But the rest of us aren't immune either. In many of the rest of us, the sciatic nerve actually bifurcates and passes both right above and right below the piriformis muscle. Now, when this muscle gets tight or goes into spasm, it winds up compressing the sciatic nerve, and that's what actually causes these symptoms. So loosening up this muscle can reduce that compression, therefore reducing symptoms. So how can we loosen up the piriformis muscle? Before we understand how to stretch the piriformis muscle, we should understand what it does. The piriformis runs between the anterior surface of the sacrum and the top of the greater trochanter. The greater trochanter is a part of your femur. If you poke into the side of your thigh near your hip and you feel a bony protrusion, that's your greater trochanter. Now, when the piriformis muscle contracts, it's going to do one of two things. It's either going to externally rotate the hip, or if the hip is in a flexed position, it's going to abduct the hip. Abduct means move away from midline. So now that we understand what the piriformis muscle does when it contracts, let's talk about how to loosen it up. I have two stretches for you today for the piriformis muscle. The first is one that I see recommended very frequently. It's one that's pretty commonly known, but we're going to discuss how to do it effectively. Now, I like this stretch because it's easy to perform in a desk chair, which makes it seamless for a lot of people to work into their daily routine. The downside of this first stretch is it does require a moderate amount of hip mobility, so it can be difficult for some patients to perform. If this stretch is difficult for you, fear not, the second stretch is going to be a lot easier. Now, these stretches are going to stretch the piriformis muscle in two distinct ways. So if you're able to do both, it might actually be useful to work both into your routine rather than picking one or the other. Now, without further ado, let's talk about this first stretch. So like I said, this first stretch is going to be performed in a seated position. And what we're going to want to do to start is take the side that we're wanting to stretch, whether that's the right or the left, take our ankle and bring it up into a figure 4 position. That means we're resting the ankle on the opposite knee like so. At the same time, we're going to let this hip externally rotate. That means the knee's moving down until it's in a nice and relaxed position. You shouldn't have to work very hard to maintain this position. Now, before we move forward, I do want to address something that's a little bit counterintuitive. If you're an anatomy person, you might be thinking, why are we externally rotating the hip to stretch an external rotator? That doesn't make sense. That should actually shorten the external rotator. And you would be right. But like I said, the piriformis does two things. It externally rotates the hip, but it also abducts the hip when it's in a flexed position. When we're sitting like this, we have our hip flexed at 90 degrees. That is putting it in a flexed position. And the other thing that this stretch is doing by bringing our ankle toward midline is adducting the hip, which is the opposite of abduction. So it's working against that second action rather than the first action. If that's confusing, please don't worry about it. Just know that this is an effective way to stretch that piriformis muscle. So once we're in this figure 4 position, we're going to sit up nice and straight, keep that back nice and straight. We're going to hinge forward at the waist, and we should start to feel a nice stretch in the side of our hip here, back in our gluteal region. Most people don't have to lean forward very far to start to feel this stretch. You don't need to be very aggressive with it, just lean forward until you feel a nice stretch there. We're going to hold that stretch for about 45 seconds to a minute. And if this is helpful for you, you're going to repeat about once per day. You can do it more than that. So let's say between 1 and 5 times per day. If that position was difficult for you, or if you're looking for another way to stretch the piriformis muscle, then this next stretch is for you. We're going to perform this one lying on our back, and you want to bring your feet about hips width apart. From this position, try to bring your knees together. If you can bring your knees all the way together so that they're touching and you still don't feel a stretch, that's okay. Try moving your feet a little bit further apart and repeat. If you do find a good position where you're feeling a stretch, you should once again feel it similarly in that gluteal region. We're going to hold this stretch again for about 45 to 60 seconds between 1 and 5 times per day. And those are your tips for the day. If you found these tips helpful, that's wonderful. I hope this was the advice that you needed to combat your sciatica and get on with your everyday life. If this wasn't as helpful for you, like I said, there are a lot of different things that can cause sciatica, and we're going to be covering a lot of them over the next couple of weeks. So make sure to stay tuned for more tips. Either way, thank you so much for watching. Have a wonderful week, and I'll see you next time.